Thinking of the advantages that you just now said, anybody who, a patient with the starting of diabetes up to 15 years of diabetes, when you are starting a treatment, this combination is pretty powerful and does not have the risk of hypoglycemia. The only patients whom you cannot use SGLT inhibitors would be when your EGFR is below 30. On the other hand, you can always use this combination. The other thing is contraindication for incretin-based therapy is that if you have patients who had any history of acute pancreatitis. Otherwise, this combination of these two agents is pretty safe in a large, broad spectrum of type 2 diabetic patients. It is also much more useful in patients in whom you want to make them lose some weight. The other important point is you know that in Indian diabetic patients, you have what is called uh, big abdominal adiposity or central adiposity. And it has been shown that using a SGLT inhibitor not only sometimes reduces the subcutaneous fat a little, but it has got an effect specifically on the visceral fat. So it can reduce insulin resistance and therefore reduce the risk of cardiovascular risk or complications. So I think there's a pretty large spectrum of diabetic patients from the age of 18 to all the way up to age of 65 to 70. You can use this combination. Of course, you will not use this in very elderly people above the age of 80 years, where the EGFR has already dropped and who also have a risk of dehydration or a fall, because SGLT inhibitors can probably induce dehydration in elderly people. So in frail patients, you don't see. But the large proportion of patients that you see in your clinic, this combination is pretty useful and can be used with very good confidence, and predictive value is pretty high. Thank you.